Let's learn about schizophrenia. Schizophrenia is a serious mental disorder in which people interpret reality abnormally. Schizophrenia may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior that impairs daily functioning and can be disabling. People with schizophrenia require lifelong treatment. Early treatment may help get symptoms under control before serious complications develop and may help improve the long term outlook. Schizophrenia symptoms involve a range of problems with thinking or cognition, behavior, and emotions. Signs and symptoms may vary, but usually involve delusions, hallucinations, or disorganized speech and reflect an impaired ability to function. Symptoms may include delusions. There are false beliefs that are not based on reality. For example, you think that you are being harmed or harassed. Certain gestures or comments are directed at you. You have exceptional ability or fame. Another person is in love with you, or a major catastrophe is about to occur. Delusions occur in most people with schizophrenia. And hallucinations. These usually involve seeing or hearing things that doesn't exist. Yet, for the person with schizophrenia, they have a full force and impact of a normal experience. Hallucinations can be in any of the senses, but hearing voices is the most common hallucination. And disorganized thinking or speech. Disorganized thinking is inferred from disorganized speech. Effective communication can be impaired, and answers to questions may be partly or completely unrelated. Rarely, speech may include putting together meaningless words that can't be understood, and sometimes known as word salad. Extremely disorganized or abnormal motor behavior. This may show in a number of ways, from childlike silliness to unpredictable agitation. Behavior isn't focused on a goal, so it's hard to do tasks. Behavior can include resistance to instructions, inappropriate or bizarre posture, a complete lack of response, or useless and excessive movement. The negative symptoms. This refers to reduced or lack of ability to function normally. For example, the person may neglect personal hygiene or appear to lack emotion, doesn't make eye contact, doesn't change facial expressions, or speaks in a monotone. Also, the person may lose interest in everyday activities, socially withdraw, or lack the ability to experience pleasure. So, symptoms can vary in type and severity over time, with periods of worsening and remission of symptoms. Some symptoms may always be present. In men, schizophrenia symptoms typically start in the early to mid 20s. In women, symptoms typically begin in the late 20s. It's uncommon for children to be diagnosed with schizophrenia and rare for those older than age 45. So, symptoms in teenagers. Schizophrenia symptoms in teenagers are similar to those in adults, but the addition but the condition may be more difficult to recognize. This may be in part because some of the early symptoms of schizophrenia in teenagers are common for the typical development during teen years, such as withdrawal from friends and family, a drop in performance at school, trouble sleeping, irritability, and depressed mood, lack of motivation. Also, recreational substance use, such as marijuana, LSD, or methamphetamines. I'm not sure about the pronunciation. Methamphetamines or LSD can sometimes cause similar signs and symptoms. Compared with schizophrenia, symptoms in adult teens may be less likely to have delusions, more likely to have visual hallucinations, and to see a doctor. People with schizophrenia often lack awareness that their difficulties stem from a mental disorder that requires medical attention, so it often falls to friends or family to get them help. Helping someone who may have schizophrenia. If you think someone you know may have symptoms of schizophrenia, talk to him or her about your concerns. Although you can't force someone to seek professional help, you can offer encouragement and support and help your loved one full qualified doctor to find a qualified doctor or mental health professional. If you if your loved one poses a danger to self or others, it can't provide his or her own food, clothing, or shelter, you may need to call emergency responders for help so that your loved one can be evaluated by mental health professional. In some cases, emergency hospitalization may be needed. Laws on involuntary commitment for mental health treatment vary by state. You can contact community mental health agencies or police departments in your area for details. And suicide thoughts and behavior. So, suicide thoughts and behavior are common among people with schizophrenia. If you have a loved one who is in danger of attempting suicide or has made a suicide attempt, make sure someone stays with that person. Then, causes. It is not what causes schizophrenia, but researchers believe that a combination of genetics, brain chemistry, and environment contributes to development of the disorder. Problems with certain naturally occurring brain chemicals, including neurotransmitters called dopamine and glutamate, may contribute to schizophrenia. Neuroimaging studies show differences in the brain structure and certain nervous system of people with schizophrenia. While researchers are uncertain about the significance of these changes, they indicate that schizophrenia is a brain disease. Risk factors. Although the precise cause of schizophrenia isn't known, certain factors seem to increase the risk of developing or triggering schizophrenia include having a family history of schizophrenia, some pregnancy and birth complications such as malnutrition or exposure to toxins or viruses that may impact brain development, then taking mind altering or psychoactive or psychotropic drugs during teen years and young adulthood. Then complications. Left untreated, schizophrenia can result in severe problems that affect every area of life. So complications that schizophrenia may cause or to be associated with include suicide, suicide attempts and thoughts of suicide, then anxiety disorders and obsessive compulsive disorder or OCD, along with depression, abuse of alcohol or other drugs including nicotine, then inability to work or attend school, financial problems and homelessness, social isolation, health and medical problems, being victimized, aggressive behavior, although it's uncommon, and prevention. There is no sure way to prevent schizophrenia, but sticking with the treatment plan can help prevent relapse or worsening of symptoms. In addition, researchers hope that learning more about risk factors for schizophrenia may lead to earlier diagnosis and treatment. Some other aspects. So, schizophrenia is a mental disorder characterized by a range of symptoms that affect a person's thoughts, emotions, and behaviors. It is considered a chronic and severe mental illness that can significantly impair individuals' ability to function in daily life. The exact cause of schizophrenia is not fully understood, but it is believed to result from a combination of genetic, environmental, and neurobiological factors. Some reasons: multiple areas in the cerebral cortex, prefrontal lobes in which neural signals have become blocked or where processing of the signals become dysfunctional because many synapses normally excited by the neurotransmitter glutamate lost their responsiveness to this transmitter. Then excessive recruitment of a group of neurons that secrete dopamine in the behavioral centers of the brain, including in the frontal lobes, and or abnormal function of a crucial part of the brain's limbic behavioral control system centered around the hippocampus. And causes schizophrenia is once again the last one, abnormal function of a crucial part of the brain's limbic behavioral control system centered around the hippocampus. And schizophrenia is a complex mental disorder with multifactorial causes. While the exact reason is not fully understood, researchers have identified several factors that may contribute to the development of schizophrenia. These factors can interact in various ways, making it difficult to pinpoint a single cause. The cause of schizophrenia include genetic factors. There is a strong genetic component to schizophrenia. Having a family history of the disorder increases the risk of developing schizophrenia. I'm sorry for mispronouncing schizophrenia. However, it's important to note that genetics alone do not determine the development of schizophrenia, as identical twins who share the same genes do not always both develop the disorder. Then environmental factors. Various environmental factors may play a role in the development of schizophrenia. Prenatal exposure to infections, complications during birth, and maternal stress during pregnancy are some environmental factors that have been linked to an increased risk of schizophrenia. So, neurotransmitter imbalances. Schizophrenia is associated with disruptions in the brain's neurotransmitter systems, particularly dopamine and glutamate. Dopamine dysregulation has been linked to positive symptoms of schizophrenia, while glutamate abnormalities may contribute to cognitive impairments. And brain structure and function. Structural and functional brain abnormalities are often observed in individuals with schizophrenia. These abnormalities can affect various brain regions, including the prefrontal cortex, hippocampus, and thalamus, leading to the characteristic symptoms of the disorder. Then, drug abuse, substance abuse, particularly cannabis and stimulants, has been associated with the increased risk of developing schizophrenia, especially in individuals with a predisposition to the disorder. Then stress and trauma. Stressful life events, trauma, and adverse childhood experience may contribute to the onset and exacerbation of schizophrenia symptoms in susceptible individuals. Then immunological factors. Some researchers have proposed that autoimmune response or abnormal immune system functioning may be involved in schizophrenia development. It's essential to understand that schizophrenia is a complex interplay of multiple factors, and not everyone exposed to these factors will develop the disorder. Additionally, individual susceptibility and the interaction between genetic and environmental factors likely play a crucial role in determining who develops schizophrenia. Early detection, proper treatment, and support can significantly improve the outcomes or for individuals with schizophrenia. If you or someone you know is experiencing symptoms of schizophrenia, it's important to seek professional help from a mental health provider. So, symptoms of schizophrenia are categorized into three main groups, like positive symptoms, positive in the sense unusual experiences or behaviors that are not typically present in a healthy individual. They include hallucinations, sensing things that are not actually there, such as hearing voices, seeing things, or feeling sensations that others cannot perceive. And delusions, holding false, irrational beliefs that are resistant to reasoning or contrary evidence. So, common delusions include paranoia, grandiosity, or beliefs of being controlled by outside forces. Then, disorganized thinking, difficulty in organizing thoughts, leading to incoherent speech and trouble concentrating. The negative symptoms, this involve a reduction or absence of normal functions and behaviors. Negative symptoms include affective flattering, reduced emotional expression leading to a lack of facial expressions, tone of voice or gestures. Alogia. Alogia in the sense decreased speech output, resulting in reduced verbal communication. Then adenoia, loss of interest or pleasure in activities that were once enjoyable. Then avolition, decreased motivation to initiate and sustain purposeful activities. Cognitive symptoms, schizophrenia can also affect cognitive abilities, including impaired memory, difficulty in recalling information or making decisions, trouble in attention, struggling to focus and maintain attention, poor executive functioning, difficulty in planning, organizing, and carrying out tasks. Now we are going to learn about treatment. Schizophrenia is a complex and chronic mental disorder that requires long-term treatment. So antipsychotic medications, these are the mainstay of schizophrenia treatment. Antipsychotics help manage symptoms such as hallucinations, delusions, and disorganized thinking. There are two main types of antipsychotic medications: typical first generation and atypical second generation antipsychotics. Atypical antipsychotics are often preferred due to their reduced risk of certain side effects. Then psychotherapy. Different forms of therapy such as cognitive behavioral therapy or CBT can be beneficial for individuals with schizophrenia. Psychotherapy can help individuals manage symptoms, improve coping skills, and enhance social functioning. Then social support. Strong social support from family, friends, or support groups can significantly aid in the management of schizophrenia. A supporting environment can improve treatment adherence and overall well-being. Rehabilitation. Occasional and social rehabilitation programs can assist individuals with schizophrenia in enhancing their daily living skills, finding employment opportunities, and integrating into their communities. Then, hospitalization in severe cases or during acute episodes, hospitalization may be necessary to ensure safety and stability. Then, lifestyle modifications. A healthy lifestyle, including regular exercise, a balanced diet, and sufficient sleep, can complement medical treatment and improve overall well-being. It is important to remember that each person's experience with schizophrenia is unique and treatment plans should be tailoring to their specific needs. A qualified mental health professional, such as a psychiatric or psychologist, can help develop an appropriate treatment plan based on individual circumstances. Next is about Parkinson's disease. Basal ganglia. The basal ganglia help plan and control complex patterns of muscle and movement. Clinical syndromes resulting from damage to basal ganglia, Parkinson's disease and Huntington's disease. So Parkinson's disease, which is also known as paralysis agitans, it results from widespread destruction of the portion of the substantia nigra, the pars compacta region of basal ganglia that sends dopamine secreting nerve fibers to caudate nucleus and putamen. And the disease is characterized by rigidity of much of the musculature of the body, involuntary tremor of the involved areas even when the person is resting at a fixed rate or 3 to 6 cycles per second. Tremors will be there. So serious difficulty in initiating movement called akinesia. Then postural inability caused by impaired postural reflex leading to poor balance and falls. Other motor symptoms including dysphagia, impaired ability to swallow, speech disorder, gait disturbances, and fatigue. The cause of these abnormal motor effects are unknown. Dopamine secreted in caudate nucleus and putamen is an inhibitory transmitter. Destruction of dopaminergic neurons in substantia nigra allow caudate nucleus and putamen to become overly active and possibly cause continuous output of excitatory signals to corticospinal motor control system. These signals could overly excite many of or all of the muscles of the body and this leading to rigidity. And then some of the feedback circuits might easily oscillate because of high feedback gains after loss of their inhibition leading to tremor of Parkinson's disease. It is an involuntary tremor. And treatment with L-DOPA. It ameliorates rigidity and akinesia. L-DOPA is converted in brain to dopamine and it restores normal balance between inhibition and excitation in caudate nucleus and putamen. Then treatment with L-diprenyl. This drug inhibits monoamine oxidase, which is responsible for destruction of most of the dopamine after it has been secreted. Therefore, any dopamine that is released remains in the basal ganglial tissues for a longer time. So, appropriate combination of L-DOPA and L-diphenyl deferral therapy usually provide much better treatment than use of one of these drugs alone. So Parkinson's disease symptoms. Possible early non-motor symptoms: loss of sense of smell, drooling, constipation and gastrointestinal problems, then sleep problems such as restless leg syndrome, then mask-like facial expression, then common motor related symptoms: slow movement, trauma while muscles are at rest, rigidity or stiffness, then blinking less often than usual, then trouble swallowing, unstable posture or walking difficulty. Parkinson's disease motor skills symptoms: bradykinesia, mask-like face, decreased blinking, degrading fine motor skills. Vocal symptoms: rigidity and postural instability, tremors, then walking or gait difficulties, then dystonia, pain, gastrointestinal tissue, then swelling and melanoma, sense of smell, mental behavioral issues. So non-motor skill symptoms are like that. Once again, vocal symptoms: rigidity and postural instability, tremors, walking or gait difficulties, dystonia in the sense the repetitive muscle movement that makes body parts twist, include depression, anxiety, fatigue, sleep problems, and cognitive ability and personality changes. Parkinson's disease symptoms: stooped posture, masked face, back rigidity, forward tilt of trunk, reduced arm swing, flexed elbows and wrists, hand tremor, tremors and legs, slightly flexed hip and knees, shuffling, short stepped gait. So, what are the types of Parkinson's disease? Primary Parkinsonism, dementia associated with Parkinson's, atypical Parkinsonism, multiple system atrophy, RMSA. Parkinson's disease, normal dopamine, but Parkinson's patient, dyskinesia, tremors, slowness, stiffness, dopamine. Central nervous system associated functions like depression, there will be depression, anxiety, decline in intellectual functioning, dizziness or fainting, lungs, upper airway obstruction, abnormalities of ventilatory control, muscular weakness and aches, then intestinal constipation will be there, then eyes, forced closure of the eyelids or blepharospasm, then mouth, difficulty speaking, excessive salivation, difficulty in swallowing, a soft or low voice, then skin, increased sweating, systemic tremor and slowness, impaired balance, small handwriting, sleepiness, trouble moving or walking, and masked face.